Hello, amazing people. Welcome back to the channel. My name is Carrie, and if you didn't know, I am a certified physician assistant as well as a certified personal trainer, and this channel is all about having fun, being fit, and I want to incorporate more women's health topics because I think it is so important for women to understand our bodies, and as a person in healthcare as well as fitness, I see the need for it, and so I want to start incorporating that as well. So for the video today, as you can see by the title, it is going to be all about natural family planning. There are a lot of opinions about natural family planning. There are a lot of thoughts and false information, and so I just want to clear it all up. As a healthcare professional, this is not medical advice. I am in healthcare, but I do not want this to be construed as medical advice. This is just a chat from one gal to another about natural family planning. Natural family planning is a method of birth control or contraception that can be used for planning a family, so understanding when you are fertile, or it can be used to prevent pregnancy, which is again understanding when you're fertile and just avoiding having unprotected sex during that time. This is not a very popular method, and for good reason. A lot of times it's not perfect and it's kind of difficult to keep track of. You have to track a lot of different things in order for it to be really a great method, but there are a lot of misconceptions about it. A lot of people think that it's actually not a good way at all, that most people who use it will get pregnant, and that's not really true. I'm going to put a chart up on the screen from the American Academy of Physician Assistants, and it is a chart that shows like all the different contraception. Okay, so sorry about that. The camera died. So back to it. So natural family planning is a very difficult method to use. And so for a lot of people, it's not very effective because you have to be really good about tracking. You have to remember to take your temperature every morning, all this different stuff. It is very difficult to do properly. Let me show you the chart. So with typical use, natural family planning method of the symptothermal method, which is the method that I would use with typical use, is 2 to 8% of women have unintended pregnancies within the first year of use. And with perfect use, with the proper use, it's less than 1%, which is the same as an IUD, it's the same as the Depo shot, and it's the same as the contraceptive pill with perfect use. Now, in comparison, just to show you that this is a comparable method of birth control, the contraceptive pill, so a lot of people use this, as well as the patch or the vaginal ring, those with typical use, 9% of women have an unintended pregnancy within the first year of use. So 2 to 8% with the symptothermal method, it's pretty comparable. So that's just something to think about as well. Off of my high horse about the effectiveness of natural family planning, let's talk about what all is involved and let's see if maybe this is something that you would be interested in doing. I do want to also mention I have not used this method yet, but I do plan on it. As somebody who is in healthcare and who's also into fitness, I have become very aware of all of the things that may be affecting my whole health, and being on hormonal contraception of any form, whether it's, in the uterus, whether it's taking pills, an injection, all of those things do affect your body and do affect your health. And so you do have to balance out sort of the weight of hormones versus the ease of use, all of that stuff. So for me, I am planning on doing natural family planning, and I will bring you guys along for that journey. But I just want to say I haven't used it yet, but I have done a lot of research, and with my background, I feel like I am able to speak on it. There are 5 main principles with natural family planning. There's the calendar method. There is taking your temperature, which is the basal body temperature measurement. There is checking cervical mucus. There is the symptothermal method, which is basically a combination of a couple different methods. And then there is lactational amenorrhea, which is basically breastfeeding and not getting your period yet. So that is obviously something that you can only do postpartum. It's not perfect though. I would never say if you're breastfeeding, you're good to go. You do not need to use protection. That's probably not true. A lot of women start ovulating before they actually have their period. It's kind of hard to tell, and like a lot of women bleed for a while after, you know, giving birth because it's a very traumatic experience, and so it's kind of hard to trust that. But anyway, that is one of the 5. So basically most women are going to have access to 4 of the 5 unless you just gave birth. Let's talk about it a little bit more. So the calendar method is using the length of your past cycles, and we know exactly how the cycles work. You kind of calculate out when that fertile window is, and then you cannot have unprotected sex during that fertile window. Let's talk about the menstrual cycle first so that all of the rest of this stuff kind of makes more sense. Love talking about this. Honestly, it sounds weird, but I do. I love women's health. So the menstrual cycle starts with day 1 is the period. So you're shedding your uterine lining, your estrogen levels are low, no embryo implanted in your uterus, and that's why your body's like, all right, let's get reset here. So you shed the uterine lining. Usually the period lasts like, 4 to 7 days. Then your anterior pituitary starts to release FSH, which is follicle stimulating hormone, and LH, which is luteinizing hormone. Those hormones start to slowly rise. In your ovaries, you have little eggs. You're born with all the eggs you're ever gonna have. These eggs start to develop. And as the eggs develop in the ovaries, the follicles start releasing estrogen. So around day 7, you had your period, estrogen is rising, and this increase in estrogen is like a negative feedback, and follicle stimulating hormone, which is causing the eggs to grow, will start to drop off. So basically, FSH starts to drop off. The smaller follicles start to die off. One follicle becomes dominant, the big boy. That one keeps growing, keeps producing estrogen. Eventually, estrogen peaks, and this causes LH to surge. So it's the LH surge. That happens around day 13. This LH surge will cause ovulation. The egg will extrude and kind of enter into the fallopian tube and start traveling down. Ovulation typically happens around 28 to 36 hours after the LH surge, and it's like 10 to 12 hours after like the peak of LH. That's a good way to tell about ovulation. We'll get into that later. After the egg is extruded, the little follicle like piece that's left behind, they start to form the corpus luteum, which produces progesterone. It also produces a bit of estrogen as well, but progesterone is really rising at this point, and it is preparing for a possible implant. So your body every single month is prepared to get pregnant, okay? So after ovulation occurs, now you've entered the luteal phase. This is around 14 days long, so kind of adds up with like a typical 28-day cycle. Progesterone is high because the corpus luteum is producing it, and your body starts to build up that uterine lining. It starts to really vascularize it and make it a really nice homey place for an egg to implant. So if you don't get an implant, progesterone decreases, the corpus luteum starts to break down. Because those hormones are dropping, estrogen is low, now you're gonna get a period again. That is the start of the next cycle. Starts with the period in like days 1 to 7, and then the LH surge happens around day 13, and then around 14 days later, after the luteal phase ends, you get a period again. Knowing that that is how it works, one disclaimer is that a lot of women do not have a 28-day cycle. Some women have variations in their cycle, so sometimes it's 28, sometimes it's 31, sometimes it's 26. You don't know. And so that is why, going back to all the methods, we're gonna start talking about the calendar method. All right, I have my notes here because I don't wanna mislead anybody, and I wanna make sure I am telling you the proper information. So the calendar method, like I said, it uses the length of past cycles to predict that fertility window, which is right around ovulation. You have to track your cycles for at least 6 months up to a year to get a really good feel for how long your cycles are. You wanna know how long your longest cycle was and how long your shortest cycle was. So we know that the egg is viable for up to 24 hours after it's shot out of the follicle, okay? Sperm, those little guys can survive for up to 5 days. So that gives you like a 7-day window of fertility. And that's why we need to know how long your longest cycle was and how long your shortest cycle was, because that could change when you're ovulating. The first thing you do is find out your shortest cycle, and then you subtract 18 days from your shortest cycle. And then you find your longest cycle and you subtract 11 days. The first day and the second day, that is your window. So let me give you an example. If your cycle is the perfect 28 days, like I said, most people are not, but let's say it is. And let's say it's always 28 days. So 28 minus 18 gets you 10. 28 minus 11 gets you 17. So your fertile window is day 10 to 17. In that period, you should not be having unprotected sex unless your goal is to have children, in which case, have a lot of sex. That is how we use the calendar method. Obviously, it's not perfect. For one, your window can be pretty large depending on the variation in your cycles. And for two, we're not always sure exactly when ovulation is happening, so can have a little bit of leeway there. The other thing that you can do is basal body temperature. Your body temperature will typically be pretty much the same if you take it every morning. Preferably the best time to take it is early morning, right as you're waking up, the same time every single time you measure it. So you can't do morning one day, evening the next day. It's not gonna work out. The basal body temperature method will show you when you are ovulating. Basically an increase in about 0.4 degrees Fahrenheit, 0.4 to 0.5 depending on where you look, shows that you are ovulating. So you measure it over 3 consecutive days and then ovulation is considered over. It's not perfect because it kind of shows like, oh, hey, I just ovulated. A little too late for that now, but it just kind of gives you more data as to when you're ovulating. And so you can use that, like you want to use past data to kind of inform your future decisions. It's just good to have that historical data because you can kind of confirm, hey, I'm ovulating. The other thing you can use is an ovulation test kit, which just measures the LH. So when you have that surge in LH, it'll pick up on it. You do not want to be having unprotected sex when you're ovulating if you are trying to use this as a form of birth control. The other thing is cervical mucus, and there's a few different methods, but they all kind of come down to the same thing. When you are ovulating, your cervical mucus becomes this like thin, clear, stretchy, egg white type mucus. That is showing that you are ovulating. There are a couple different methods. There's the 2-day test, which because your cervical mucus will become more abundant when you're ovulating as well. So the 2-day test is, did I have mucus yesterday? Did I note mucus today? I'm ovulating, I am fertile. That test isn't perfect either because some people have different like discharge in different times of their cycle. Again, I stress the importance of combining multiple methods. Then we get to the symptothermal. So this combines many different things. It combines the cervical mucus, it combines the basal body temperature, and that is what I would recommend doing, is combining these methods. With that one, you would be tracking your cycles, knowing generally when your fertility window, keeping track of your basal body temperature so you know when you're ovulating, does it line up with that fertility window that you have calculated? Checking cervical mucus, okay, is the mucus changing also when the body temperature is changing? Combining all of these things will help you stay really informed. And so you'll know you don't have to not have sex during that fertile window, but you should be using some other form of protection during that fertile window. And so I think that's something else that people are like, well, when do you have sex then? You can't have it for that 7 to 10 days, and you can't have it when you're on your period. It's not as enjoyable for some people, whatever. You can have sex during that period. You should be using some other form of protection. That is it for the natural family planning. So like I said before, this can be used for a form of birth control, but it can also be used to help you get pregnant. If you're having fertility issues, it's really helpful to know when you're ovulating so that you know when the best chance is for you to have the sperm meet the egg and get a little baby in there. If you guys have any questions about that, I know there's a lot that we talked about with the menstrual cycle and all the different ways of keeping track of things. Data is super, super important. And there are a lot of cycle trackers. There's Flow, there's Glow, I think it's just called Cycle Tracker. There's a lot of different trackers that you can utilize to help you keep track of all these different numbers and when you're having your period, when you're ovulating, all of that stuff. So it doesn't have to be complicated, but I would say make sure that you have really good data before you like completely rely on this method. I would say you should be open to having children if you are using this method. There's always that slim chance, no matter what form of contraception you're using, that you could become pregnant, and so you have to be open to that possibility. But I would say that this method is better than many people think if you are using it properly, if you're well educated on it. All right, guys, so I hope you enjoyed this video. That is it for today. Thank you for watching, and I hope you learned something about natural family planning. Even if you don't plan to use it, it's good to know about it. Let me know. Maybe I'll do a video on all the different forms of contraception. As a healthcare provider, I am very well versed on them, and I educate patients on it all the time. So if you're interested in learning about all the different forms of contraception, please let me know, and I will definitely do a video about that. But thanks for tuning in, and I will see you next time.